Hello everyone. It's another episode of our talk with students about placements. Today we've got two of our students and we've got Nadia as well. So shall we start off with our students? Yeah, so introduce yourself, guys.
Okay, so my name's Aarti and I did community pharmacy in Leicester.
Yeah, and my name is Zainab and I did community pharmacy in William Hall and I was a Tesco pharmacy.
And my name's Nadia. I'm not a student. I teach on the MPharm course. I do clinical pharmacy and I'm also in charge of placements as well. So I do the whole thing.
Good. So basically, guys, we've got you here today because we're doing a series of podcasts, a few episodes where we speak to our students that have gone on placement. So the first one was about SCSs and how we set the whole thing up. And we did one with just students, which was me, a few of your colleagues, and that was about hospital pharmacy. And today we're just going to be talking about community pharmacy. So the main aim really is just to get your thoughts and feelings and experiences about what you did and what you liked and what you didn't like. How does that sound?
Mm-hmm.
Good. So did you guys, either of you, work in pharmacy beforehand?
No, I've had a couple other jobs. I've been working since I was 16, but I've been in leisure, so I was a lifeguard and I'm a swimming teacher, but I never worked in a pharmacy, so the most I'd done in terms of like that much or customer service was either like on reception when I'm a lifeguard or when I was volunteering at a charity shop and on tills.
Mm-hmm.
Yeah, I'd never really I know a lot of people go into any kind of healthcare professional having done at least like a week of pharmacy placement. I think it's really easy to get work experience, but I never did it. So I didn't really know what to expect when I first walked in. I've worked before. I've been working since I was 14. I tutor privately and things along that. I have other side jobs and stuff, but other than that I haven't really done anything with customer service to that extent before.
Okay. How was you feeling when you were going to go on placement? So when you was anticipating it, was you nervous, excited, or what were your thoughts?
I think I was nervous I was scared that I didn't know everything, because obviously it was a new environment. I'd never really been behind the counter in a pharmacy before, so I didn't really know what to expect and what my supervisor expected of me. I didn't think that I had that kind of clinical knowledge as well to be working in a pharmacy, and I was kind of scared that what if I make mistakes? But again, I was excited because it's one of those new experiences and it's one of those things that not a lot of pharmacy students get to do, so it was it's just mixed bag of feelings.
When you started then, so let's say day one for example, or even the first week, how did you settle in? How did you find that experience of going from never being worked in a pharmacy to then all of a sudden you're on the front line, you're in a pharmacy, you're with pharmacists in a whole dispensary and a team? How did you go from sort of being our students to then being in a pharmacy and adapting to that environment?
I loved it. I was really excited for placement. So when I got in on the first day, obviously we weren't they were kind of apprehensive because it's a first year student and they knew we were there for 3 months, but they weren't I don't think it had processed to them that we were going to be there for so long. So when it came to the first week, obviously as a first year student they don't know what to expect of us.
Has your perception changed since the start of the placement and to obviously undergoing that 13 weeks?
No, I kind of understand that it's a lot more than just handing out prescriptions and things like that, because there's honestly a lot of work that just goes into clinical checks and a lot of consultations as well. In general, there was just a lot to do, and it wasn't just handing out prescriptions or getting people to buy things over the counter and things like that. So I think that's how my perceptions changed, and also looking at how important the pharmacy profession is in context to healthcare. Even when it comes to legal checks and things like that, we're kind of like that middleman between healthcare medications and those going to the public, and that's really important that we keep that regulated as a profession, because things can go wrong.
Yeah.
And that's why we're so important, because we're there to make sure they don't go wrong.
Mm.
Yeah.
Were there cases where you thought something had gone wrong, or you've seen something go wrong, and then what did you do when you saw it happen?
Honestly, the way that, like, I was grateful because my supervisor was actually really good. I did obviously make mistakes, as anyone first stepping in the pharmacy would. But the way that they handled it was good, because I'd make a mistake and it'd be just like, just a small mistake. But again, that small mistake can lead to big consequences regardless, because we're talking about medications and drugs. But it would be approached as, oh, this part was wrong, try it again. Do it again. You might have missed on that one. And my supervisor would tell me, just do it slowly. Don't be pressurized by the time or somebody waiting, because it's so much more important that you do it correctly than you do it in a rush and then you miss a step or you do a mistake. So I think I had a really supportive environment. So if I did do a mistake, it wasn't like, oh, you've done something so wrong and like you don't deserve to be here or things like that. It was very supportive in the sense of, it's okay, mistakes happen. I've made mistakes before. This is how you fix it. This is how you can prevent them from happening again. Yeah.
How important do you think it was for your development at the end of that placement that your supervisor was that supportive and that you didn't have that pressure that if I make a mistake, I'm going to get into deep trouble?
I think it was so important. A supervisor made such a huge difference because it literally depended on your supervisor if you'd love your placement or not. Because if you are scared, if you're not comfortable enough with your supervisor to ask questions, or if you have made a mistake, own up to it to that supervisor, then I don't think you could have had a good time at placement, because you'd just be very heavy, really.
Yeah.